Hello, friends. Today I'm going to talk to you on a topic which is very close to my heart, and that is the importance of clinical medicine in today's era of what we call investigative medicine, and how we need to focus a lot on clinical medicine even when we have so many investigations available. And I'll start with one story. I could tell many stories, but I'll start with one story about a patient I saw many years ago. She was a patient of breast cancer. She was operated, and the surgeon felt that he had taken the tumor out and she should be all right. She went and had a follow up PET scan done a few months later, and the PET scan showed uptake in the lungs, in the glands in the lungs, in the right upper lobe. It showed uptake in glands in the abdomen and in the ileocecal junction. This patient was told that now you have developed disseminated malignancy, your cancer has spread to all parts of the body, and you just have a few months to live. And this caused a lot of anxiety and depression as far as this patient was concerned. So when I saw this patient, I realized that this is not the site where breast cancer spreads to. These are the sites where you commonly see tuberculosis, upper lobe involvement, glands involvement, ileocecal junction involvement. And I told this patient, I think you have tuberculosis, you start anti-tubercular treatment. She went and got a biopsy done which showed granulomas, started on ATT, and she totally recovered. And now it's been more than 10 years and she is having no symptoms. So if we had gone only by the investigative report, we would have missed the diagnosis and we would have really caused more harm to the patient than good to the patient. Therefore, in today's world of investigative medicine, it becomes imperative that we look at clinical side also, take the history properly, use clinical sense to really make a diagnosis rather than just going by what the reports tell us. And I think this is something very important. Remember, almost 70 to 80% of the diagnosis can be made by good clinical history and by examination. And sometimes that helps you more than the investigation that you ask the patient to do. Because of lack of cognitive skills or clinical failures, almost 40% of diagnosis can actually be wrong. So this is data which is available in today's world. And that's why clinical medicine scores over investigative medicines in many areas. These areas include early recognition of a disease, where the pattern gives you an idea rather than the labs, because the lab reports may take time to come. Also at times differentiating life-threatening disorders from benign disorders, where clinical skills will help you more than what the investigations tell you, and being able to decide whether a normal report really means something or there is something more behind that report. So I think you have to use your clinical skill even in today's era of investigative medicine. Examine your patient properly, think about all that you've seen, collate all your data. Don't rely only on the lab reports or on the investigation that you have in your hands. Please see your patients, because that will give you a more holistic approach. I hope this has been useful to you, and I look forward to giving you more insights based on my experience. Do stay tuned in. All the best. My best wishes.